Hello everyone. Today we are going to study about the management of seizures due to the alcohol withdrawal. So, in the emergency, as we can see many seizure cases and the loss of consciousness and other thing due to the alcohol withdrawal among the adults coming. So let's talk about this. So for the objective, identify clinical feature of alcohol withdrawal seizures, CY scoring, and the treatment of the alcohol withdrawal seizures. So why there is alcohol withdrawal seizure occurring in the patient or the person is like if there is dependence of the any alcohol or the drug for the long time, then when there is the sudden withdrawal of that substance, then like dependence of that causes the symptoms to occur in the person. So minor withdrawal is there is tremulousness, mild anxiety, headache, diaphoresis, palpitation, anorexia, GI upset, and normal mental status, which is the onset is 6 to 36 hours after the last spring, and seizure like single or brief flurry of generalized tonic-clonic seizure, short post-stroke period, and the status epilepticus are rare, and the onset is 6 to 48 hours after the last string. And the alcoholic hallucinations like visual, auditory, or the tactile hallucination with intact orientation and normal vital sign. Like these tactile hallucinations are more common in the emergencies. Like the patient will complain about like there is moving of the spider in their body, and that type of hallucination will they will complain, and it occurs 12 to 48 hours. And the delirium tremors like delirium, agitation, tachycardia, hypertension, fever, diaphoresis, which occurs 48 to 96 hours. So for the like these upper two, then we can look for some time and then we can send them home. But for this lower two, we have to do much investigation and do the treatment in the ER also. So for the typical onset during 4 to 5th decade of life, but also in the 20th also, I have seen many cases of this alcohol withdrawal symptoms, and usually a single or occur as a brief flurry of seizures over a short period, and for recurrent and prolonged seizure, rule out underlying structural or infectious etiologies. So CY scoring, clinical institute withdrawal assessment for alcohol, which is devised. So there are some parameters which we have to look for, and we have to add that score, and if the total score is less than 10, then very mild withdrawal, and the 10 to 15 mild withdrawal, 16 to 20 modest withdrawal, and the for greater than 20 we have severe withdrawal. So the parameter which is like 9 parameter 63, and 1 parameter for the 4 means 4 60 maximum score is 67. So what are the like 9 parameter which we must know? So nausea and vomiting, tremor, proximal sweat, anxiety, agitation, tactile disturbances, auditory disturbances, visual disturbances, headache, and the orientation and crowded sensorium. So this is little tricky to give assist like what is the, like grading of the nausea, vomiting, or this, because there is not enough parameter to give the number. Like in the 0, no nausea and vomiting, and for the 4, intermittent nausea and heavy high hips. So in this between, the physician have to do the clinical assessment and give grading by his or own. So the scoring is little tricky, but the symptoms which we see in the patient, then we get idea about the what are the condition, like what is the like modest withdrawal or severe withdrawal. So in the headache, this parameter. So rather than remembering these things, just we have to know this topic: nausea and vomiting, headache, paroxysmal sweats, auditory disturbances, anxiety, visual disturbances, agitation, tactile disturbances, and the tremor, and in grade 4 like orientation and clouding sensorium. So maximum can be 67. So for the management, supportive care should be given, and the benzodiazepine like diazepam 20 mg 4 times daily over a period of 5 to 7 days after symptoms have subsided. And the for the severe liver diseases, asthma and respiratory failure, lorazepam is given because in this like it is excreted and metabolized from the kidney. So in the liver diseases we can freely use this lorazepam naprox, so it is mainly used. So for the Wernicke-Korsakoff syndrome, high dose of the thiamine, vitamin B1, which is Pabrinex, 2 vials 3 times daily for 48 hours, and then orally 100 mg 3 times daily given. And the acamprostate, 666 mg 3 times daily, and the disulfiram to decrease or to relieve the dependence of the alcohol syndrome. Disulfiram is given. So alcoholic hallucinations like chlorpromazine 100 mg 3 times daily given, and naltrexone long acting drug which is also used in the alcohol dependence. So reference, and thank you. So thank you for watching.